Today we're going to talk to Dr. Caren Frost, a research professor, director of Global Social Work Research, and chair of the MSW Global and Health Concentrations in the College of Social Work. Thanks for being here.
Yeah, thanks, Jen. Thanks for asking me.
First off, what are some of the health issues that are faced by refugee women who've resettled in Utah?
Right, so some of the women that we're working on for this study that we're talking about today actually come from some of the countries in Africa, and they've experienced severe trauma, whether it's physical trauma or emotional trauma, and along with that comes physical ailments, emotional, mental health issues that we need to help them, sort of work through. Physical health issues usually have to do with their need for reproductive health information. So one of the pieces that we're working on with this study is looking at reproductive health, sexual health, and how do we meet their needs that way.
Why is the impact of geospatial issues important to healthcare or to social workers?
So one of the things that we notice with the women that we've been working with for our reproductive refugee health committee is that when we were running a workshop, it was very difficult for the women to tell us where they lived. In addition, it was very difficult for us to go and pick them up and bring them to the workshop, which was a mind-boggling piece for me because it's not something I ever considered, not knowing where I was and what was going on in my own neighborhood. So it really speaks to how they access and how they understand where the resources are that they're going to need. So it's more than just the fact that we couldn't get people home after the workshop. It's more about, so are there clinics in your neighborhood? Are there libraries where you could get access to information? Is that available in your neighborhood? What kinds of schools are in your neighborhood? So it's more about how do you identify resources and where they are in relation to where you live. And that's a really big issue.
Okay, well, so then what can social workers and healthcare professionals do to help refugee women get better access to those resources or whatever resources they need for themselves and their families?
So one of the things that we need to keep in mind as healthcare providers or social work providers is to make sure that people know what's available in their neighborhoods. So if we can give them a small list and help them to understand this health clinic is right around the corner from your house, this school is over by your neighborhood, and show people how to get places and understand what's available to them in their areas, that's what we can do as professionals.
All right, well, thanks so much for talking to us today.
Great, thank you for asking.